I'm Allison Cumming-McCann. I'm chair of the counseling department at Springfield College.
Good afternoon, I'm Patricia Arredondo, and I'm a visiting professor at Springfield College for the last couple of days, and also from Phoenix, Arizona with the Arredondo Advisory Group, and happy to be here.
And we're happy to have you. My name is Michael DeAndrea. I'm an associate professor here in the Department of Counseling at Springfield College.
Well, we're really pleased to have a conversation this afternoon about some thinking that we've been processing around how we integrate meta theories into perhaps a new framework that could be useful in counselor training and education and even research, of course, and practice. And so what we're going to talk about together today are the multicultural counseling competencies that many people are familiar with, which have the tripartite model of awareness, knowledge, and skills. To that, we're going to add to our conversation the theory of emotional intelligence. And many of people are familiar with that because in many ways, emotional intelligence aligns with the cultural competencies. If we look at the stages of emotional intelligence in terms of self-awareness, self-management, social awareness, and of course relationship management, which is obviously terribly important in multicultural counseling. And then our third theoretical model for consideration in this integrative framework would be the relational cultural theory developed by women psychologists at the Stone Center in Wellesley. And the relational cultural theory also is a developmental stage model that talks a lot about how, again, our awareness about others is necessary in order to develop that relationship. And we'll get a little bit more into it. I think Michael can explicate the stages and consider how the integration of these could actually prove to be very effective in our work as counselors. Oh.
I do want to kick off here by saying, in terms of full disclosure, I think all of us and many people who will see this video have crossed the RCT, the emotional intelligence and the multicultural counseling competencies as separate entities, and I think we're familiar, but you really have brought to the table in your stay here the introduction of the firm fit of these three therapeutic frameworks into one, and I had not conceptualized that before, but I'm really excited about the potential because a meta theory is a theory about theories, and I think once we can begin to explore the integration of these three theoretical models, the more effective we're going to be as counselor educators and as practitioners in the field. And so with that, let's open it up for discussion.
You know, when you said that, and I'm just going to jump in right now, we talk a lot about, as far as being a counselor, is how important it is to engage in analytical thinking. That this is not a rote learning process, and because we're working with people, we have to think through how we are going to engage, and that requires analysis. I mean, that's a critical thinking skill, and so that's what we're proposing here, but in a very overt and explicit way. So what do you think, Allison?
Well, I think the powerful part is it allows you to kind of burrow down, right? That there's this analysis you can burrow down in these concepts that we often get. So in multicultural theory, there's these concepts. What does that mean? What does that really look like on an emotional level? Without getting to the place where we're providing students with a roadmap or index cards, it's more about them really understanding conceptually ways of being and how those ways of being are going to impact the work that they do, right? So I think that piece is really interesting. We were just talking a little bit about how, in many ways, relational cultural theory is incongruent with the typical and traditional messages that students are given, that Americans, not mostly, at least dominant culture, are given and the ideals
Mhm.
that are presented to our students. So it also requires some thinking about how this might be in contrast to maybe not how students feel, but what they imagine as being right or just, right?
Oh, sure. Sure.
So I think what were the three that you kind of were talking about?
The three things, and it's so clear, I think, to the three of us, other people that are viewing, but what is the programming we receive from systems? And those systems are family and workplace and schools, but it also has a lot to do with how we program our students in counselor education. We rely on traditional, Western biased kind of theories. And when we ask ourselves, what makes a mature person in human development? Three things stand out. And one is, you have to learn to be independent. Stand on your own 2 feet. Take care of yourself. And the second thing for a sign of maturity, psychological maturity, is you have to be an autonomous thinker. Think for yourself and be independent. And then the third one, which is a real kicker for us, and that is when you become independent and your own person and you're autonomous, we kind of move into separating ourselves as children from our parents, as adolescents, from our parents and other authority figures. So those three issues are really something that are deeply embedded in the students that we teach in counselor education programs, to promote independence, to promote autonomy, and to emphasize the importance of separating yourself from individuals.
And of course, that is a contrast to many cultural groups that do not expect the separation and individuation of their teenagers or their young adults. For them, emancipation is you're getting married, and okay, fine. So that's the separation. But I think we superimpose that in with our developmental model of identity, for example. And I think when I look at those three levels, that they really are in contrast to other culturally, grounded groups. And it's not a good or a bad, it's different. But I think you're right. I think we say this is the task, you're going to individuate.
Yeah. Well, and that's the normal, that's normal development.
That's
and
normal,
we don't
and
often
that's just
is. We teach these theories.
Yeah.
This is how development should be, and if it's not,
Yeah.
And I think an important part of our training with students is we want them, let's get down to the economics of this. We want them to be marketable and successful in the workplace and our healthcare system. And with that, we want to remain viable as a part of the healthcare system in the United States. Here's the thing we're looking at, and we all know this and the viewers know this, is that we're going through this unprecedented demographic transformation, which primarily has what? Been a majority of people from Western European, English-speaking, usually Christian, and backgrounds. Now we're shifting into the majority of people will soon be from non-Western European, non-English-speaking, and increasingly non-Christian backgrounds. So the question is, if we want to remain viable, if we want to remain marketable, if we want to be relevant in a culturally diverse society, then we need to look at these kind of issues going on. So let me turn to you and ask you a question, and that is, as the pioneer along with Daryl Sue and Rodney McDavis in establishing those really groundbreaking competencies that went in there, what's the roadmap that those competencies provide us? And I do want to acknowledge Dr. Thomas Parham, who recruited the three of you, because he was the centerpiece of this. But how do you see the multicultural competencies providing us with a roadmap for what we're going to talk about later with RCT? And
what I think is incredibly valuable about the competencies is that they are in some ways generic enough to accommodate application in different venues. So if you look at, let's say, the counselor awareness of one's own values and biases, okay? So the counselor awareness there, for me, being trained as a counselor, and I think developmentally, okay, everyone individuates, everyone separates, everyone's autonomous. That's a bias I have, all right? And if I'm not aware of that, I can really get into some malpractice, okay? So now I'm working with a woman client who, let's say, is coming from a Muslim background. She's not, her parents aren't going to, and she could be here in college, she's not going to be into separating,
Mhm.
being autonomous, individuating,
Mhm.
and I'm there as a counselor who's learned all this. But if I do not have enough knowledge from the second part of the model, which is counselor awareness of clients' worldviews,
Mhm.
then I am really going to make some errors if I don't consider that the cultural differences are authentic for her,
Mhm.
and that the work I'm doing is not to encourage her to leave her family,
Mhm.
because that again is not the way to facilitate a culturally responsive answer.
But
So,
sometimes, and maybe much of the time, that unintentionally goes on in terms of that form of institutional racism but so if I hear you right, you're saying, okay, first of all, we have to be aware of our own biases. And then number two, we have to increase our knowledge about the biases that other people bring as a result. And it's not right or wrong. It's being aware of our biases and then being knowledgeable of the clients.
and I don't even know if it's the client. I mean, I guess I don't think about it as the client's biases, because we talk about it specifically as the
Okay.
client's worldview.
Mm-hmm.
So how does this client operate? What are their norms? I think you used that word yesterday. What are the norms in the culture of the client? Because remember, the client is there getting help, okay, or getting assistance. As a counselor, this is where I think we've learned all of these beliefs. We have all of these beliefs from our counselor training that bias us in terms of how we see people or how we treat people in counseling, our expectations, and they're very much coming out of our training. And then let alone how you've been brought up. You know, so if you've been brought up in a family that says, go forth and, you're out of the house when you're 18 kind of thing, you're going to say, well, what's the problem here?
This is what we do.
So,
This is
and
what our
that's
goal
that's
is.
so much of what we do.
Yeah.
I remember, one more anecdote, I was on a panel a few years back, probably too long back, maybe almost 20 years ago at ACA, and it was a Latino panel, and we were talking about some of the errors in counseling if you're working with a Latino client or a young person, and typically it's like the idea that if you are not separated from your family, then we say you're enmeshed. So the pathology that then follows if the person is not living according to, again, the norms and the biases that we're taught are appropriate. So enmeshment,
And I think it's interesting from a kind of systemic perspective. So if we have an increasing population of Latinx students coming into institutions, and if they're seeking help at the same rate that we're seeing students seek help, which is wonderful, but they're going into a counseling center, and the messages they're getting is that kind of being individuating. You're very enmeshed with your family. You need to separate. You're here in college. This is your time. Like all of those messages that are so normal within dominant culture, and we don't always do the best job, I think, as counselor educators deconstructing those to say this is one way of viewing the world.
Oh, totally. I just think that there's so much work that we can do, Michael, with this kind of, the social awareness also fits in from the emotional intelligence model. The social awareness fits into the counselor awareness of clients' worldview. We live in a society here in the United States that is highly multicultural. I mean, we don't even have to get to a numerical majority minority. I mean, it is a multicultural society. I'm walking around Springfield, I'm walking around your campus, and I see that it is a multicultural campus. And therefore, I would say this is where, talking about our systems, our counseling education is a system of education, and I think in that regard, we have to kind of unpack the system.
I like
we
that
have to
image.
unpack the system in order to kind of get things in a different track, and this is where culture counts in everything.
And I want to just short comment on the two of you talking about enmeshment. And I say this because I think it's a reality, not to condemn anyone in our field who are counselor educators, but I noticed that the term has become so popularized, like enmeshment, codependency.
Oh, yeah.
People will talk about that, and that's a way of pathologizing, right? Folks who relationships, right?
Yeah.
So I think that's a message that I'd kind of like the viewers to kind of consider, because I notice students with the best intent come and talk about codependence, and even in a society here in Springfield where the numbers of Latino persons are dramatically increasing. So I did want to make that point, but in that you move from self-awareness in the stages of emotional intelligence to the social awareness. And this is a dicey area because you're really talking about social political issues in terms of social awareness. And I really think it's a challenge to all of us, regardless of where we stand on our personal beliefs. How do we grapple with promoting a critical analysis of the social political conditions right now that are increasingly antithetical to the multicultural movement? And I wonder what reactions either of you have to what's going on right now, and how do we model social awareness from a systems perspective, helping students to more fully and critically understand social awareness.
When I think about it in the context of emotional development, it is modeling the discomfort, modeling to students the vulnerability that goes along with being dissonant, right? Like, so social awareness means I have to question everything I once knew. It means I have to acknowledge that there are spaces I move more freely in than my colleagues might move. It means knowing that I actually participated in systems of oppression. Like, so that to me is the social awareness piece. And so I think modeling, rather than assuming students know it or that they're wrong for knowing, they've been conditioned to know things the way they know them. And so it's, I think that's that, and it's not easy, and different students have different levels of resistance to it based upon their own stuff that's been going on, right? But I think that's that, so this is where I see the emotional intelligence piece slipping in, is just how really, really deeply considering, like, how do we sit in discomfort? How do we sit in our anger and rage? Because that's also a really important place to go as you're learning about injustice, whether it affected you and you'd internalized it, or you thought it was your fault, or when you realize, and I think so often people in dominant groups realize they've been lied to, right? And there's that, they're good and just people, and they, to be in the second year of a college class, to finally realize that, wow. So, I don't know, I mean, I think modeling it.
I think I want to get real specific here. I think we have something special going in the counseling department in Springfield College. And one of the things is the relationship faculty have with the director of the program, with Allison here. I told you about a disconcerting dynamic in the classroom where there are a few white students who are operating at that naive stage of white consciousness going on. And I found myself getting angry at that, and I managed it in that class setting, but I'm preparing for the next class, and I'm thinking, how do I deal with this? And I thought, it's funny you're talking about being aware of our own feelings, because I think when I'm going to present tonight to the white students, to say, I really can empathize with how you're feeling, because when I came through in late adolescence and in a counseling program, I thought good counseling was good counseling. I thought, Rogers was on the wall for everybody going on. I thought helping people be independent was good for everybody. And so I was saying, what's the big deal here? And it wasn't until I was confronted with African American males and females who said, are you saying that you only see the human race, you don't see race when you're around people? And I said, yeah. And it was well intended.
Of course,
It was to be accepted. But then I was said, so you're discounting me as a black person and the oppression I've experienced intergeneration. Is that really what you're saying? And how do you think it makes me feel? So I want to share those stories with the students. And I know it's vulnerable because people may say, oh, so he's saying he was a racist at one time doing that. So I really appreciate the support we get here and what you're just saying right now in terms of its connection with emotional intelligence.
Well, one of the things, and I find as well that that social awareness is, as we're saying, is part of the social political ethos, which is always there. It's how intentional we bring it into the conversation. So about 2 years ago, from 2016 to 2018, I taught, and I taught graduate students and in the multicultural counseling class. And what I decided to do was have a current events conversation at the beginning of each class, and this was explicit on my syllabus. And I said, all right, you need to look at what's going on in the world, mind you, 2016, okay? 2018, and it was the spring of 2016, I think was the first semester I taught it, and then went around. And I said, so you come into class and share something that you believe is pertinent to the work we're doing in this class in terms of multicultural counseling. So I generally didn't disclose anything because they were full of it. They brought in example after example of something that had happened and was reported in the news, or that they were just so bothered by. You know, it was whether it was the Laquan McDonald shooting in Chicago, or one of the other what was the man who was choked in New York? That might have been before
Eric Cantor.
Yeah. And so all of those things they witnessed, right? I mean, by the news. So they would bring those in. Mind you, I'm in Arizona, and there was a primary election, and they had closed. They didn't make all the polling sites available, so there were long lines. People were standing in line until midnight to vote. So some things like that which are unjust, all right? So I didn't have to bring it, but they were becoming more conscious because they had to pay attention. And then how does that relate to what we're doing in class?
I like that a lot.
So I just throw that out there in terms of social awareness.
Well, and I like it because so often when we talk about social justice, we do have a handful of students that think that racism is something of the past, or that the incidents we're seeing are just, you know, manifested because of Trump, or, you know, and so there's without recognizing that there are systems and structures in place that continue to repeat themselves, and most of them aren't shocking to people of color, they're shocking to white people, or men, or, you know, whatever group we're talking about. And so I think that bringing it into the current really allows students to see how it continues to manifest itself. And then I would say the other piece is connecting it too, because these aren't novel things that are happening. The reason that police in Dallas, Fort Worth go into homes with their guns out is because of redlining, right? There's this long history of how and where people of color were supposed to live, and so there's poverty, there are, you know, all those things, and so it's connected to our past. It's not a novelty of today, it's connected to our past. So finding and getting students to see both and connect to both. I think that we spoke last night in our class about the woman getting shot and just what it would be like to be, you know, it just brings it current. Like none of our students can imagine sitting in their room playing a video game.
No, with your nephew and an 8-year-old child. I think the other thing that when they identify some of these incidents and then bring them to class and talk about them, and then I do think it is a way of increasing empathy. You know, because you could say, put yourself in the shoes of that mother or that child, and you know, was separated from their parent at the border. You know, put yourself in those shoes, and it's I think that perspective taking around a real incident brings it home quite often, and it creates I think a sensitivity that you can't get out of a textbook.
I think about the idea of collaboration and not independence, but that interdependence and the community building that we should be doing kind of in our courses and in our cohorts. And so when a student hears the pain and struggle from a peer even, right? So they may not believe it, they're still reading about it, but when a student says, you know, I just had a son, and I love that I have a son, but I'm terrified for him to grow up as a black man.
Correct.
To watch their peers who love this person, who've been with them for a year and a half, see the struggle of that what should be a really happy moment.
Mhm.
There's no way you can't
Mhm.
connect
No,
with
you
that in a
can't.
level, and you will never be able to erase that, and it will make you a better
I
counselor.
would say so. I would say so.
Because you
yeah.
know,
Mhm.
you now know something you can't not
Mhm.
know.
Mm-hmm.
Well, I'm glad we're having this
Yeah.
conversation because I'm picking up tips that I'm gonna incorporate in my class. And given that the emotionality
Mm-hmm.
rises, as you just said, with this, can you talk a little bit about your thinking about the emotional management that goes on and the regulation? And we know it's tied into neuroscience a lot. The folks in the relational and cultural theory organization, they talk about the importance of understanding the basis of it from neurological. But in general, what do you do? What can we do to help ourselves develop a greater level of emotional management, regulation, and help our students to develop that?
And you know, one of the interesting things is the language we use. I was just hearing you, emotional management and emotional regulation.
Okay.
And it as though, we're in this field that it's easy to control our emotions. And number one. And number two is that emotions have different ways of manifesting. Okay.
Good.
So I could feel emotional. You might not know I'm feeling emotional, but I can be feeling emotional, that emotional dissonance. I could be, shaking. I could be crying. I could, my face changes, which is another way. So I think I'm just, as we're having this conversation, how do you unpack that emotional emotional management, emotional regulation? It's a very Western way of talking about emotions.
Well, and I think about how emotions are manifested differently within different populations,
of course.
right? So we, in my class, we watch a film, and then one of the fellows, I believe he's a counselor, and he's as part of this conversation, and he says to one of the other men in the film, like, "Oh, now I can understand you, because Carlo was getting angry and sad," and he says, "Now I see your anger. Now I'm with you." And you kind of cringe as a white person when that's said, but I could hear myself saying it at one point in my career. I know, like, now you're real to me, he says. Well intended.
Yeah.
But I think in our counseling field, we create a very small box about what emotion looks like what. We label it very specific ways. And as we try to, if we're coming from, an affective approach, we think there's only one way of expressing emotion. And that can just, in that situation, it was turned from a person who is vulnerable to being very angry. Like, I'm done.
You're going to say that, call me out that way? Yeah.
Now I'm real.
But I think it's also not only the cultural manifestation of emotions, as Allison is pointing out, and how that varies, but then the gender piece. And, we so often immediately expect that men don't show emotions. That's so classic. And then, that women showing emotions is very normative and okay because we're women. So you also have the way that emotions are genderized. I don't know if that's such a word. They're genderized, and it doesn't leave again, I think that's somewhat of a bias that's built into the expectations around emotions.
Well, it's interesting. 3 weeks ago, we had another colleague and friend, Dr. William Parham, and he was giving an interesting kind of purview how he deals with women and men when it comes to emotional reactions. So he says a lot of women come to counseling manifesting depression. And when he talks to women, he says, so geez, the things you're pointing out here pretty much go along with the diagnosis of depression. And we'll get to that. But I'm wondering, what sort of things make you angry? And so he has that kind of perspective from a gender difference rather than reinforcing the depressed path, And then he said with men who have anger management, when he comes to him, he says, you're showing symptoms of anger problems, and we'll get to that, but can you tell me a couple times when you were young, you were sad, and you felt you lost something? And so you're talking about the gender differences and manifesting different emotions, and I think he added to that.
Yeah, definitely. And using different words, feeling words, if you would, or like with the woman, anger, or what was the word he used with her? Yeah, anger, right?
Yeah.
Because she came
Yeah.
in looking
Yeah.
depressed, so anger, and then with the man's sadness. Yeah.
And then he said, women that get to a point of expressing anger,
Mm-hmm.
because it's so unacceptable for women, what do they refer to? She's a real bee, right?
Mm-hmm.
So they kind of, and what about the guy who manifests the emotions of sadness? Well, he must be kind of weak, right? Look at him acting that way.
So we have all of these attributions when it comes to emotions that are very gender based. Oh, it's a curious thing. So when you again, when you look at the relationship management piece and emotional intelligence, how different it's going to look with different men based on cultural upbringing, based on generation, and just where they've lived. I mean, how they've lived their life. I think that's going to show a bit different in the corporate world. I had a man I worked with one time. He was a CEO. We're sitting at a meeting, and he was very upset about something, and he started to cry. And everybody thought, "Oh my God!" And it was. They said that it was not out of character, but however, that would not have been normative in some other boardrooms.
That's right.
No.
And this is where I think the folks in relational cultural theory come into play. They talk about this concept of controlling images that we get cushioned. And what I hear you saying now is, in many boardrooms, the controlling image is he's crying. No, he's not. That's not appropriate. So we have this controlling, genderized, and racialized image that goes on.
It's not what a leader's supposed to do.
That's not right.
No, but of course he's the leader, so he can do whatever the heck he wants to in that boardroom. I mean, candidly,
Right?
Yep.
Yes.
candidly. I mean, he was
Absolutely.
still the boss after that incident, and he remained the CEO for a number of years after that. So it had no. For him, it wasn't really there wasn't a consequence. So I think it depends on
Sure it does, and
where you sit in this room.
And that intersectionality. So
Correct.
he might have had a lot of other boxes
Yep.
checked.
Oh,
That if
yeah.
he deviated norms, he had a little bit more privilege to deviate
Totally,
those norms
totally, yeah.
than other individuals.
We talk a lot about the importance of assessing our effectiveness in counselor education programs. One of the things that I have found useful is to talk about controlling images in the first class, what that means.
Yes.
And then midway through the semester, I say, okay, can you write 2 paragraphs about a controlling image you came into the class with, and now you're questioning or alternating that. Second part of that is, why do you think you're changing that? And then again at the end, in the last class, we look at controlling images and to see if they're growing or developing. It's good from, I think, a counselor educator perspective.
I think it's an excellent. I guess it's an excellent practice. It's part of awareness building. I think we try to teach the students to scan the environment and to see who's there, and in that scanning, it's so, I think in all of us, it's not a good or a bad, the stereotyping that occurs just based on who you see and what you project onto that person. So controlling images, I really would say, is a very great practice.
And it fits with the competencies, I think, real well, the multicultural competencies.
Well, and getting students to begin to question it, right? So we know we've done our job when they say, I can't even watch a movie anymore without thinking about good, because then you're questioning those controlling images that are channeling you without your knowledge in many cases. And once you know, you can't unknow.
Yeah, you can't unknow. There's a great article, it was written by Susan Fisk in the 90s on the power of stereotyping and who has the power to control stereotypes. And it's the person in the power position. So this is a counselor typically. He or she can control the stereotype of the client. The client generally doesn't have that authority or privilege, but I thought it's a very excellent article about the power of controlling stereotypes.
And I wonder how frequently, because I do think it's frequently, in staff meetings when we're talking about students, we have some concern about how easily accessible stereotyping is in our language in staff meetings when we're, talking about students going on here. I think that's a very important
Yeah.
point you're
Yeah.
making there, yeah.
If I can add something about the student piece, because in the last couple of years I sat in on faculty meetings when a student was being discussed. And to the credit of most people in the room, they had engaged in very self-regulation about not making comments about the student that would in any way pathologize him or her. So it was just a behavior. They weren't allowed to say, well, so-and-so is very emotional or so-and-so seems depressed. They were only allowed to say what the behavior happened to be that was being questioned or discussed. And I really thought it was important to stay within the lines because we were otherwise, I would say, just doing what we're teaching students not to do, is talking about them in ways that, we're not diagnosing them, we're looking at their behavior. Yeah.
Well, you've done a real nice job, or we have done a nice job looking at the multicultural competencies and the importance of counselor awareness and then knowledge of clients and then skills. And we've looked at how it fits neatly into the emotional intelligence theory. And now we're talking about some of the key concepts around relational cultural theory, the importance of connection and mutual empathy and controlling images that go on. Is there any other things you think we should add to share with the viewers of this video?
Yeah, I think we talked a little bit earlier about emphasizing systems more and the power of systems to contribute to the status quo or to remain static, because the systems give us all the rules, all the rights and wrongs, and I think systems also have to be questioned as far as how relevant they continue to be. And in looking at, just to talk about, I think earlier, counselor training, counselor profession is a system of, it's a system, and we have, norms and we have ethics and so forth and so on. Given all the conversation we've had today, it is very timely to question some of what we considered to still be the mainstream theories in counseling.
Let me add to that,
Right?
though, something that I think is important to leave the viewership here, and that is the system of the multicultural social justice movement in the counseling profession and in psychology. And I want to talk specifically about you two. That's a system. That's a system that's challenging what many of us consider to be harmful and oppressive concepts on diverse people. And the two of you are models of that. You kind of looking at systems change from the multicultural competencies, helping ACA to endorse the competencies, working with the guidelines for the American Psychological Association. So, I hope that people are picking up the hopefulness. If we are about changing the world, not just individuals, the multicultural social justice movement is the sort of system we need to be reinforced. And you're a good example of this here, Allison, in terms of women's rights and multicultural diversity in a small private organization. So we need to see how our competencies, in multicultural emotional intelligence and RCT really are important in, keeping hope alive in what we're doing and changing the world. I know that's something you two echo in your different presentations, and I appreciate that.
Well, it takes a lot of courage to do this change work. It means we step out of the lines. We kind of step out of the system that governs us as well. However, making change is you look at anybody who's made change and is considered a leader of change. They don't stay within the boundaries because otherwise they would be frustrated or things would remain stagnant. So I do think that it takes a lot of courage to be creative and say how about, and it's not just any old idea. I mean, we're talking about something very considerable here in terms of looking at how we integrate these various theories into some new models of practice, but also questioning I mean, questioning is part of change.
Mm-hmm.
And, we're questioning, for example, just the whole role of emotions and how we talk about them and how we gender them and so forth. So I think the courage to do and to lead towards change in the profession that will be eventually, I think, more responsive, further responsive, let me put it this way, to our changing demographics.
I think so.
I think it's really where we have to be thinking these days.
And the fact that we get to sit here around a table and have these conversations also means that we have the power to make change, right?
Yeah.
And not afraid, so I think it's using that power, using the resources to be change agents. It takes a little less courage for us than others sometimes.
That's true.
Good point,
I think it's absolutely true. And then that's why one of the reasons for whoever our viewers are to consider being active in a professional association, because that is a place where you meet people who are thinking about social justice change, about leading with cultural competencies, and you have those conversations where you can be supported and perhaps do some new and creative ideas.
And working together with other allies is important, but I want to put a pitch out to my own group, and for those viewers who are white students and faculty members, I want to build on what you're both saying. We need to have a greater level of courage to step out, because we are privileged and we are in power positions in a majority of institutions in our country. So if you really are down with the multicultural movement and the social justice movement, let's amplify our courage and step out of line like these two folks have talked about, and help us really change the world, because together we can and we will.
Thank you.
Thank you.
Thank you.
Thanks.